When are we going to get to a point where we stop glamorizing being overweight, obese, unhealthy, and having our organs swimming in excessive fat and not able to function? I'll wait. There's nothing cute about being overweight and obese and actually realizing that it can be a big cause of your death at a premature age. Magnify. The new pandemic after COVID is obesity. Mark my words. We are going to die from excessive fat. Re tlo bolaya ke mafura. Sizoshona. Sibulawa mafutha.
Mama magnified. Mama magnified.
Magnified family, what it do? Kalibito, Kilisakha Mofokeng, also known as Mama Magni. Let's talk about the elephant in the room, which is the fact that there is absolutely nothing healthy about being overweight and obese. I come at you guys with yet another pertinent conversation that I think we need to have. Do the right thing, subscribe, like, and share this video with anybody who you think is actually going to benefit from us having these frank conversations. We are actually going to dive right into the elephant in the room, which is the fact that we have access to life-changing data and research that tells us right now that being overweight and being obese and living with obesity or being overweight is going to kill us faster than anything at this point in time. And there's so many stigmas around being obese or overweight, particularly in different cultures, right? We have grown up in a time where, particularly for men, it is seen as unestima when you are a man or plump, a man unomkhaba, and it depends who you ask, right? But it's also seen as ondlegile, you know, and we're all guilty of all the stigmas around obesity and being overweight. And the sad reality is it's become now a culmination of all these things that have brought us to a place where right now we are in the information era, and there's more and more education and understanding that we cannot continue to live in a state of being obese and overweight, because it is basically living in disease. You are basically sick in the body. And this morning I really just wanted to share from an educational perspective. I am not a healthcare professional. I am not a doctor. I'm coming in the capacity of just having a frank conversation and be able to drive thought-provoking conversation for all of us to actually ponder on our general health, right? Because again, I've said on this channel, what good is it when you are taking care of your spirit, man, but your body is decaying every day? How are you going to carry out your heavenly assignment here on earth when your body is decaying every day? So we've also just been in the era of social media previously where we have glamorized, you know, or give it a nice name, you know, I'm plus size, which is good, right? Because you want a positive body image. But I'm here just to talk about our health in general, because we're now living in times where a woman is now trying to conceive and your doctor's telling you your obesity or being overweight is a problem, because the reality is there are so many risks and being prone to so many diseases in your body by virtue of being obese or overweight. So I think a good place to start is also just to demystify all the stigmas, is the fact that it's beyond just you've eaten yourself to the state, right? It's beyond just you didn't exercise all your life. It's beyond just, you know, eat healthier. The reality is it is a very complex chronic condition. And yes, guys, obesity is defined by the World Health Organization as a chronic condition, right? Because it is beyond just your caloric intake. It is beyond just eat less and work out more. There's actually so much biology going on in your body in terms of your metabolism. There's a lot going on in terms of your genetics. There's a lot going on in terms of your psychology. There's a lot going on hormonally in your body for you to be living with a condition like obesity. And so the first thing that I would love to start with is the World Health Organization definition of obesity, because we are doing an educational conversation here, so we need to be factual when we are talking around these. So obesity is a complex chronic disease that is characterized by excessive fat deposits that can harm your health. It sounds very simple, but there's so many parts to it that we have missed over the years. And I was listening to another professor who's a pathologist who actually broke it down quite well for us who are in the science and medical space. The fact that when we look at the evolution of our bodies and of medicine, the reality is we are descendants of a genealogy or genetics where back then, years ago, starvation is what would kill you, right? Lack of food is what will kill you, or excessive eating wasn't a thing. So because they were not living in times of abundance years ago or historically, whoever survived was the person whose body could obviously store most energy, because they were living in scarcity years ago, the evolution of where we come from. And what this then means is the fact that we've carried these genes over the years, but now we are now these people carrying these genes, but now living in a time of abundance. So now we are living in a time of, we have an abundance of everything. Ki Uber Eats, you know, we have access to food, whether it's unhealthy or healthy. We have less and less exercise. We have stressful lives. But remember, the genes in our body is still quite designed to say, we're used to living in starvation and in lack, right? And I'm just giving you a history of where everything comes from, particularly based off of what this professor shared on. And so when you look at how repetitive the cycle will be over the years and living in different times, that's how we've come to then realize it to be a chronic condition. Because remember, your body and your cells store information, or they get used to working a certain way. It's often called metabolic memory, right? So now you're living in a time where your body's used to you know, we just need to store the fat, you know. And then we're now living in a time where we are just sedentary lifestyle, we're not working out, we're not eating, and then there's a genetic component of it, right? So that's why we are saying it's a complex disease, because the reality is there's a lot going on in your body hormonally, as I've said. And then when we really look at what I wanted to share with us on this video today is just the reality of the fact that there are common factors that do contribute to people living with obesity, right? And again, it's beyond our dietary habits, it's beyond the lack of physical activity. There are many things that could contribute to you having obesity. Things like stress. I wish you could see a physical diagram of what stress does to your body, even your cardiovascular health, the health of your heart itself, which is the engine of the body. If we realized what stress does to our body's functioning. When we look at certain medications or certain other conditions that people have that could end up contributing to people living with obesity, or the body's metabolism is in such a way that you store more fat than you are using more fat. And I'm trying to use simple language and not get lost in the big words that we use in the medical field. So the challenge becomes there's more fat or energy being stored than being used up. And so long term, that's how you end up in this chronic state of just fat being dumped all around your body, right? And then we know there's hormonal changes. You guys know that hormones are far beyond just testosterone and estrogen. There's sex hormones, that there's different hormones in our body for different functions. There's thyroid hormones for different functions, and there are what I would like to call metabolic hormones or hunger hormones, or satiety hormones that help us in the space of your metabolism and how you eat and how much you eat, and the signals that get sent to your brain to say, we've had enough to eat now, we can stop eating, or we need a little bit more energy, we are starving, can we have food? These are some of the complexities that come into play for people to end up living with obesity or being obese. And then there's obviously behavioral factors that we cannot deny, and this is the one that is close to my heart, because for where I am right now, and I shared a little bit when I went to the doctor recently, is the fact that you have to look at the psychological impact of the relationship that you have with food, because for some of us, food became a coping mechanism, right? I had a very rough year last year, and I know as I was doing it that I was emotional eating, that food and sugar and snacks and certain things became my comfort in that time. And unfortunately, what I do want to bring across from my experience is the fact that it is far beyond your willpower. It is far beyond something that you can uzkuze. because there's a lot going on in your body hormonally, mentally, and behaviorally at that time. And that's why you'll need to check in with your doctor at every step of the way when you are experiencing certain things in your life, because you can end up putting yourself in a space where you're creating more problems. Not only. And so I just really wanted to share 5 facts about obesity that I think everybody should know. And I just want to remind us that I'm not a healthcare provider, I'm not a doctor, and I'm just really sharing this to have some education around this, because I do believe that we do need to start having responsible conversations and be holistic about it, right? Let's not shy away from important things that we need to speak about from our health in general: mental health, spiritual health, emotional health, financial health, and just be holistic people. So 5 facts around obesity that everybody should know. Number 1, as I've mentioned, obesity is a chronic disease. It is a chronic disease. It is very complex, and it is a relapsing disease because it doesn't go away. If someone has hypertension or type 2 diabetes or any chronic condition, you don't stop taking that medication. Once you've been diagnosed with it, you have it lifelong. It is a chronic condition that is far beyond the lack of willpower. It's far beyond you just being able to say no and control yourself. And the reality around it is the fact that chronic conditions are lifelong, right? So it is something that you need to ensure that you walk the journey with your doctor, and it is complex because it's caused by so many things and so many moving pieces, and it has to be diagnosed by a qualified doctor, as I have said. So number 2, obesity is driven by biology and not by choice. And this just goes back into a little bit of the science that I've shared, in the fact that it's more about what's happening in your body biologically, with so many moving pieces in your body, and it's not a reflection of you lacking self-control. There could be an element of it, but majority, or 70%, or like majority of what's happening with someone who's properly diagnosed with obesity is the fact that it's far beyond just you having willpower or self-control, or you just wafobela, you can't stop eating type of thing. And the reality is, this then leads to you having excessive or abnormal body fat stored in your body, and this is not a healthy space for your body to function, because that's when you start being at risk for so many other diseases, because your body can't live and function in that condition of having excess fat everywhere in all different parts of your body. Because if there's too much fat in your body is not wired to function in that way. So it'll end up it's gonna have to go find places to be. It's gonna start sticking onto your different organs, and no organ can live and function like imafura. And that's when you start having risks of cardiovascular disease, type 2 diabetes, hypertension, sleep apnea, liver disease. Basically your fat is just going to get stuck on any organ where it finds its space to sit, and this is where we start seeing health risks. And I think for me, this was the biggest urgency to say, I not only want to live long, but when I live long, I want to be in a healthy state with long life that my God is going to give me. So if God is going to give me the long life that He's promised me as a child of God, what is the quality of that life once God has given me that long life? And it's in the small decisions that we could make right now, when we have the information that we have, and stop being in denial and partner with our doctors to make better choices in terms of ensuring that this long life that God is going to give us, will it be a healthy, good quality of life, long life, or will we just be sick, bedridden, disease after disease, diagnosis after diagnosis? I think that was the biggest urgency for me, to just rise up and say, I need to do my part for my body. Number 3, obesity can impact health early. And this is where the aha moment hit me, where I had to realize for me to say, okay, how did we get here? I know how we got there, but we're here now. Now what? The impact and the damage has been done. And I think if there's a little bit that I can share from my blood results, the reality for me with my blood results recently did show that I'm already at risk early. I'm fairly young, but we're also now, as we grow, so many things start happening in our body hormonally, and just the general progression of life in itself, just already gives you risk. So what more if we are pre-exposing our bodies to not being at their optimal functioning and living with obesity impacting your health earlier than what it would have if you were in a healthier state. So the effects of obesity are really something we need to start realizing and looking at it from a health perspective, because as I said, from childhood, these are not some things that we look at. I still also look at my children as well, to start educating our children from a young age and start keeping their bodies healthy from a young age, because when you're carrying this excessive weight for a long time from a younger age, you're going to start having those problems from a younger age. And so early prevention and just managing it does help with the partnership again with your healthcare professional, because it does take a toll on you mentally, guys. Like, look, I had two my one aunt was morbidly obese, my other aunt was obese, my two dad sisters, and so many things are only starting to hit me now that we're exposed to this data and working in this space of chronic weight and obesity, that none of it was never healthy, it was never okay. But when I look at the reality of us living in it, it was never taboo. The only taboo thing was the physical self-image of, okay, but nobody ever looked at it from a health perspective. I had to ponder, and unfortunately my both aunts have passed away, but I've been thinking so much about how they've had to live their lives stigmatized their entire lives, stigmatized about how they look, stigmatized about how heavy they are, stigmatized about not being able to wear certain things, stigmatized by even family itself, and it's just such a sad thing to realize that we accept certain conditions as chronic conditions, but obesity is just one of those where uzenzi, it's similar to how when HIV started, the stigma around you're promiscuous, the stigma around you were sleeping around and you went to go get that disease, which is not necessarily true for every person living with HIV. And it's so refreshing to see the research that has gone into HIV now and how we are able to coexist and understand the facts around the virus and the disease and not stigmatize people who are living with HIV, because people have had different experiences of contracting the virus. And I think obesity eventually will get to that state where we actually understand the realities and the science behind a person having obesity and understanding that they didn't choose to be obese. I promise you, nobody would put their hand up and say, I think today ke batla go ba obese, itse ke khaletse go ba overweight. I think I actually want to be heavier than what I should. I want to not be able to do daily tasks of my life. Nobody puts their hand up to say they want to be obese. So fact number 4, obesity is treatable. And we are now living in times where, like I said, go partner with your doctor and find out and educate yourself on the condition itself. And it is something that can be managed and treated. It is not the end of the world, just like anything. That's how I often say, now that I know what I know, what am I going to do about it? And there are ways to treat and manage the condition so that you at least delay the risk or lessen the risk, and ensure that the risks are not as early as they are right now. Because unfortunately, a lot of chronic illnesses, relapsing as they are, unfortunately don't go away. So you're basically just managing the complications. You're delaying the oncoming complications that you are already prone to by virtue of having the condition. And then the last one, which is the most taboo one that we don't talk about, is the fact that weight bias, stigma, and discrimination harm everyone. Weight bias, stigma, and discrimination harm everyone. And this is where I would really love for us to have a bit of a pause, because all of us have weight bias. Guys, don't even try it. We all have weight bias. We all have weight bias. We all have an unconscious weight bias where you're even having conversations with yourself when someone obese walks into the room or overweight and you're low-key just like, yo babes, and then hi pony, why doesn't she do something about her body? Why how could she? Oh, whoa, girl, and even the way someone would be dressed or how someone would be carrying themselves, the stigma around the fact that why are they so, you can't be in certain rooms. You're already boxed in a certain way. That's why I made the example of the HIV, because it did come with the stigma. How many years did it take to actually eradicate that stigma that's possibly still there right now? It's just probably in a little bit less of an intensity. The discrimination that we see with people who are obese or overweight in our workspaces, in our social spaces, in our homes, in our families, in relationships. I mean, when you speak to someone who's obese, and someone does share, they'll tell you that it's even hard to date and be in romantic relationships, because you're already overthinking, how will things be? Will they accept me? Why shouldn't they accept you? You're human. But remember, we are now sitting in a time where we are working against a stigma and a discrimination and a bias that's been there for many years, and that's still there right now, without actually understanding right now the fact that it's not all the fact that uzenzile. There's so many things happening. I mean, there's women living with PCOS right now who the condition of polycystic ovarian cyst is of such that hormonally your body makes it hard for you to lose weight. There are people who do everything in the textbook, and they still don't lose the weight. And that's where it proves what we are sharing right now, is the fact that it's far beyond just your willpower and what you can do. There's a lot happening metabolically, hormonally, genetically in your brain, that we need to start acknowledging and understanding that for some people it's far beyond them trying. They've tried everything. They actually they've gotten 12 out of 10 and their body's just not responding. And that then speaks to the fact that it's far beyond just uzenzile. And I really just want us to get to the point where we respect not only people of all sizes, but we just respect the reality that people are living with different conditions for different reasons, but also just an awareness for self to self and self-reflection to say, go visit your doctor and discuss your holistic health with your doctor and understand where you are with your health, so that the long life that God is going to give you, that the long life that God has promised you, is going to be one of good quality. I want to live long for my children. I want to live long to see my children's children. I want to live long to have my husband and I old and gray and see what the Lord has said we will see in our lives. I want to get there in the healthiest of states. And like I said, to see my two aunts reflecting, looking back now, it has not been an easy journey for them until the day that they passed away. I mean, to think of the fact that my one aunt who was morbidly obese, guys, it was terrible when she passed away. It was so there were even parts of her journey to passing away that it took away even her dignity of transcending to leaving this earth. And I really just would love for us, being in this information era, to use the information that we have to stop the delusion that we have. But how healthy are you? How beautiful, great, lovely. But what is the health of your body? Your body is sick inside and you're not attending to it. Your body is swimming in so much fat that each organ can't even do what it needs to do, and you are housing the Holy Spirit in you. This temple is the temple of God. Take care of the temple of God. If we must use a spiritual analogy, maybe we must use that, because God needs us in our best condition, in our best health. He needs us to live long for the kingdom of God. We need to win souls. We need to carry out destinies. We need to change lives. We need to be change agents. We need to be Jesus ambassadors. And for us to be able to carry out that assignment, we need to be in tip-top health to be able to do that. So I hope this really has helped someone to actually just understand the reality and the condition that is obesity, the importance of how complex the condition is, and just to be able to understand, if it does affect you, to go see your doctor and have discussions with them and have them make you understand what it is that you need to do to ensure that, firstly, are you even clinically diagnosed as obese. And remember, guys, it's not just about how you look. For me, someone may not even think I am obese, but I am classified as obese. I am class 1 obese because they look at actually beyond just the weight. They look at your height, they look at your waist circumference. There's so many things that they need to look at to classify you obese. And for some of us, like I think someone like me, what helps me is the fact that I'm very tall, so the weight is distributed in a way that I could have been classified even class 2 obesity, but what's helped me is my height, that the fat is distributed a bit, vertically. But the reality is the fat composition in my body relative to my age, relative to my height, and my waist circumference has officially put me at risk of disease right now. And what a rude awakening for me, having worked in the medical space for so many years and helping doctors to save patients' lives. And today I am a patient. Today I am the patient. Today I need to live in that reality of the medical science that we've been teaching our doctors all these years. How do I sit there and not take my own advice? How do I sit there and not apply the clinical expertise that I have, that I've been trained and educated on and trained at work to help our doctors help other patients? Today I am the patient, and today I just think that with platforms that we have, with conversations that we have, being a conversationalist, having a ministry here which is not magnified, I have the responsibility for us to be able to have these conversations and ensure that we live healthier lives holistically, spiritually, mentally, and in all ways. And I really hope that this has helped someone. I hope this will help a family member that you have. I hope that this will be a tool to help drive those uncomfortable conversations that need to be had, so that we can be and see the change that we need to be for our bright future and long lives for tomorrow. I'm gonna park it here, magnified family, and I'll see you guys in the next video.